Welcome to Module 7. In this module, we will look at positions that are comfortable for you and baby and that may help breastfeeding work well. There is new research showing that when a baby leads in tummy down position, bobbing its head to find the breast, that this ends up in a deeper, more comfortable latch. You will see this in the video in this module. The baby-led approach is a natural way of putting baby to the breast. It starts with skin to skin. When mom is in a reclining position, gravity keeps baby in place because baby is on top of mom. Mom is laying back at about a 45-degree angle. In this position, mom can follow baby's movements that are baby's reflexes for feeding. The baby squirms and bobs their head. With arm and leg movements, the baby moves towards the nipple and often latches on. Mom follows baby's lead and supports baby's back and shoulders. Babies are born with instincts to help them find the breast and latch when they are in the tummy down position. This can be an especially helpful approach if baby is struggling with latching. These diagrams, which you will find in Baby's Best Chance, show some of the most common positions for breastfeeding. The cradle and modified cradle positions are commonly used if sitting upright. These positions are often easier after breastfeeding is off to a good start. The football hold can be a good position if mom has had a cesarean section incision that is sore. Sideline is popular with mothers at home. It can be more comfortable for moms who have had a difficult birth and are uncomfortable sitting or who have had a C-section. The reclining or laid back position is very helpful, particularly in the early days. It is great for having a nice relaxing cuddle while feeding, and mothers report that it feels very natural. We will focus on the reclining position, as many moms find this to be the most helpful position while learning to breastfeed. Next, we will watch a video clip that describes these positions in more detail.
Cross cradle or modified cradle position is where you hold your baby with the arm opposite the breast you're feeding from. Your hand supports the base of your baby's head, neck, and shoulders, positioning your baby to face you, tummy to tummy. If you need to support the breast you are feeding from, use your other hand. Supporting your newborn on a pillow may help keep your baby's body close to your breast. Underarm or football position is where your baby is facing you with the legs tucked under your arm. You support your baby's head with your hand at the base of his neck and his body with your arm. Your other hand may support your breast, or you can use your finger to tip the nipple towards the baby's nose. This position may be helpful if you have a cesarean birth or are breastfeeding twins. Using a pillow may help support your baby at the breast. Cradle position is what many people think of as the most common way to breastfeed. This is where you cradle your baby across your lap with your baby facing you, tummy to tummy. Your baby's head rests on your forearm with his back along your arm. Use pillows to support your baby to the level of your breast. This position is often most useful for an older baby who is breastfeeding well. An older baby no longer needs pillows. Side lying position allows you to rest while your baby is breastfeeding, but can take more time to master. In this position, you and your baby lie on your sides facing each other. Your baby can be cradled with your arm on his back. It's important that you and your baby find a way to breastfeed that works for you. Try different positions to see what works well. You don't have to use them all. The positions you and your baby prefer may change as your baby gets older.
When deciding on a position, the first thing to consider is what position is comfortable for you. Each position has its benefits. The reclining position and the modified cradle often work better in the early days. The football hold is helpful when it may be uncomfortable to hold baby in front of your body. The cradle hold is great for long-term breastfeeding. If side-lying, can this be done safely? When in bed with baby, it is important to not fall asleep. Is there someone who can be watching you and baby to keep baby safe if you fall asleep? Baby's Best Chance has helpful information on the risks of sleeping with your baby and how to lessen those risks. No matter what position you find comfortable for you and your baby, the principles of a good position are the same. Tummy to tummy with baby. It is more comfortable for baby to drink if not having to turn their head sideways. Nose to nipple. This helps baby to smell the milk. Tilt their head slightly back and open wide. Aim the nipple towards the back of the roof of baby's mouth. Skin to skin, especially in the first few days, but continuing as often as possible. Lips and chin touching the breast under the nipple. Holding baby's body close to yours. This helps your baby feel secure and positioned in such a way that their head is tilted slightly back. Always support the baby with your hand behind their neck and shoulders, but try not to push on their head. Babies will push back if held on the back of their heads. Many nurses in Fraser Health are given these breastfeeding tips cards. We all want to support breastfeeding with the same message. If you have any questions, be sure to talk to your doctor, midwife, nurse practitioner, or call 811 24 hours a day, 7 days a week, or call your public health nurse for support. Thank you for listening to this module. Be sure to check out these helpful links and resources on the web page to learn more about positions for breastfeeding. The next module is about some common concerns and tips to help deal with them and make the breastfeeding experience more comfortable and effective.